And welcome back to our discussion. So, for this lecture or for this module, we'll be talking about the research title. Okay, so this is one of the first problem the students will encounter in their journey uh, in the research process. So, it's selecting the title, formulating the title, asking questions such as what are research problems, how do I get the approval of my advisor with regards to the topic that I've chosen, is my topic research worthy or worthy of doing a full-blown research. So is my topic novel, new, or is it something that is geared towards updating uh, previous knowledge or updating evidence-based practices or EBP? Okay. So this is the very first step that you do as novice researchers is to identify researchable problems. Now, the first question you have to ask yourself is where? Where will I find this research problems or research titles, followed by how? How would I formulate them? And how will I be able to answer the research question that I crafted during my meditation or during the conceptualization phase. And oftentimes, students really have a hard time seeking for approval. So, ito yung medyo nagiging problem ng estudyante. Okay? Because most of your advisors, most of your professors have encountered a lot of topics, a lot of researches that have been conducted before. So, they are familiar with the variables that you will be using. They are also familiar with how you would be able to manipulate these variables, to control these variables, or to change these variables or modify these variables. So it's really like the experience is like going through a needle hole, okay, wherein seeking approval is very challenging, okay. But don't be disheartened. There are many techniques or strategies so that you can find your own niche in the realm of research, your own topic of interest, and your passion in doing research. Okay. But oftentimes, when seeking approval, sometimes your passion with regards to this topic is counterproductive, or your advisor or your research professor denied the proposal or your working title. That's okay. Maybe you'll be able to use it next time or when you go to postgraduate. But as of the moment, based on the assessment of your professor or your advisor, it's either too early for you, or it's too shallow, or there's a better topic for you. Okay? Okay. So there are a lot of sources of research problems, roughly around seven of them. Okay. So some of these research problems come from the intrinsic side or from the inside. Okay, meaning it's something you have experienced, it's something you have observed, it's something that you try to question. It piques your interest, it piques your curiosity. So the first source of a research problem is a feeling or discomfort, like during recitations or in making projects. So for example, you want to understand the group dynamics within a team. in terms of making a project or making an output or making an evidence-based paper. So working in groups sometimes is very difficult for some. Okay, especially since this is a actually the topic is for mixed courses: nursing, psychology, physical therapy, radtech, and education. So any feeling or discomfort that you've encountered can be turned into a workable topic. Okay, you also have to remember that uh, the topic should be connected with your field of specialization. So if you're a nurse, you have to go with nursing topics. You cannot go into, for example, conducting psychological tests to evaluate a feeling of discomfort, because that's not our realm. That's the realm of the psychology department to give psychological tests. You want for you may want to focus on, for example, nursing education, nursing community health nursing, or your majors, same as with other courses. So such as psychology, you want to focus on the theories of personality, abnormal psychology. You have these developmental psych, and you have a lot to cover. Same with PT, RT, and education. There's a lot. Okay. Next would be perceived difficulties in the management and leadership of the class or the advisor. Okay. So this is more of the dynamics when it comes to class. So the first example, the first two examples usually falls under education. So well, it can be you can use it as nursing education. You can use it as education in psychology or health education in radtech and PT. Um, but when you think of perceived difficulties in the management and leadership, you can just stick to that part and focus it on your major. For example, perceived difficulties in the management and leadership of head nurses during the COVID-19 pandemic. Okay, what were the difficulties? What were the challenges in management and leadership roles? Since in nursing, there is the concept of nursing leadership and management. In the psychology realm, you can delve on the management and leadership practices of human resource managers during the time of the pandemic, or how the HR industry or management system shifted from the traditional to the post-pandemic or intra-pandemic. Then, of course, there's also leadership in and management under PT, RT, and education. You just have to find a suitable topic or a suitable area that you think is suited for you, or you have a curiosity in that specific area. Now, the third one is this is the very common source of all research problems. It's a gap between theory and practice. Okay. It's very common that in the classroom, we teach you the proper way to do a certain procedure. For example, in the allied health, we have the proper hand washing technique. Okay. In psychology, we have the proper administration of, for example, an IQ test using the WAIS-R or the WISC. And in education, we have the different teaching strategies and how they are used inside the classroom. But when you look at the different uh, when you look at the different practices occurring in the workplace, it might not be the same. For example, uh, in theory, we for example we do a certain procedure first before going to the other procedure. But in the practice or yung nakita nyo sa area, mali, parang hindi yun yung tinuro sa amin. That's always the sentiment of students. Yung kapag nabanggit nyo na yung parang hindi naman yan yung tamang process or hindi naman nata yan yung tinuro sa amin. Then that becomes the gap in theory and practice. Now, you have to identify anong gap. Paano nangyari yun? Na iba yung tinuturo, iba yung practice. What's the underlying problem between the gap? Is it more of financial or financial? Is it more on the resources, available resources? So there's a lot of factors that you need to consider. Why the those theoretical concepts are not practiced or not utilized. So as allied health practitioners for the nursing, psychology, etc., we always we always use evidence-based practice. So what we do in the clinical area, we do it based on available evidences, based on research, of course. Okay. Next would be a daily experience of a person that requires further inquiry, especially if improvements are desired. Um, this is more common if we're talking about experiences. This is more common for qualitative studies. So if you want to focus on qualitative studies, you want to understand a phenomenon, you want to understand an experience, so that they will be able to understand themselves. They will be able to help themselves in improving their current status. Then it's more of qualitative. Now, not all experiences, you have to take note of this one, not all experiences can be researched. Okay? There's a very thin line between, for example, I want to research on the lived experiences of housewives. Okay, so housewives. The question is, why housewives? Is there something unique about their experience? Is is it very very are women who become housewives have different experiences or not nothing in common based on your common sense or based on logic? So you have to answer that question first. Is it a common experience? Because if it's a common experience and almost everyone can experience being a housewife, then it's not unique. It will not qualify as a qualitative study. What we're looking for is something that is very unique. So instead of saying lived experience of housewives, take a look at the minority of your sample size or your population. You can think of what are the lived experiences or what are the experiences of battered housewives. So you inserted a phrase there which is battered, meaning binubugbog ng asawa. So that means that experience is unique. Basically, because not everyone or not all housewives experience battering, or hindi naman lahat ng housewives binubugbog ng kanilang asawa. Then that's it. That would qualify as a very unique study or a very unique title. Okay. Next is a procedure that requires technologically advanced equipment which needs to function properly. Usually, ito yung focus ng mga RadTech or even ng mga PT. They are trying to look for competency. Competency in using their advanced equipment. Now, um, not only for RadTech and PT, but also for nurses that utilize, for example, advanced technological equipment, such as, for example, madami kasing nagugulat dun sa, medyo matagal naman na siya, yung mga retractable syringes, advances in the dialysis machines, advances in the CT scan machine, MRI machines, and other assistive devices that is very innovative or very new. Okay? Ang tinatanong kasi natin doon is competent ba yung mga gumagamit. Okay. Next would be the pattern or trend. Anong trend ngayon? Anong uso ngayon? Last year, ang uso ay pandemic. Okay? Uso 'yan. Anong implication ng pandemic sa education? anong nangyari sa delivery ng classes, from shifting from traditional to online, bakit nagsasuffer ang mental health ng estudyante, what are the experiences of healthcare workers that were tested positive during the COVID-19, burnout, stress, lahat-lahat nandyan yan. Lahat ng iniisip mo ngayon tungkol sa pandemic, sure ako na research yan. Okay? Now, that's the trend. Now, I want you to go beyond the trend. Now, since na-research siya, heavily researched siya last year, think of saan kaya papunta yung trend? Saan kaya papunta yung pattern? Ano kaya yung pwede nating i-predict using the available data na ni-research nung last year? Okay? Then, from that trend or pattern, you can formulate your own research problem. And of course, lastly, ito talaga yung pinagbabasehan ng lahat. It's the literature review. Okay? So the literature review is you have to read and read online journals. Go away with books. Ang books kasi, that's theoretical knowledge. Ang journals mo, nag-a-update yan every month. May bago. Ang books, ina-update yan every 3 years, 5 years maximum. So, kung nagbago ng edition, for example, from 8th edition yung book naging 9, sobrang late na din naman nung updating na yun kasi I'm sure from 8 to 9, mas madaming update ang online journals. You can search for online journals in Google Scholar. Okay. So, meron kasi tayo sa Google Scholar. There's a lot of scholarly journals there. Nandyan na lahat halos. SagePub, if you want to be, ang mga journals ng SagePub is highly academic. So, mapapasama na din dito siguro ang pagpapractice ninyo ng very academic-like English vocabulary or mga ganun. Then we have ejournals.ph if you want local literatures. Okay. There's PhilJol, Philippine Journal, PhilJol. You have Science Direct. You also have JSTOR. You have Pair. This is also local, JPair. You also have marami, okay? There's a lot of list of online journals that you can search, and they are always, you have to look at the impact factor nga pala, and how many citations did the journal have. Okay, so if you read and read and read journals, that would increase your chances of finding a topic or research title that is suited for you, since most of your searches involves your area of interests. Okay. Now we go on to the instances of researchable questions, okay, or ideas. So first is solutions are available but not yet tested and not known by the practitioner. If you want to discover something that would help in managing a certain disease, in managing a classroom, in identifying developmental milestone, and offer solutions to a problem, then research, you can have a lot of ideas based on this instance. Okay. Another is no solutions are available to answer the gap or the problem. Same as like what I've said, if there is no available solutions, you can provide. If there is a solution but not yet tested, yun yung number one, then you can try to test whether this solution works in the Philippines, because most of our journals come from, of course, overseas, because research in the Philippines is very lagging or medyo mabagal ang usad. So if you want to adopt a study that was conducted in China, in US, in UK, in Australia, that's okay. As long as the solutions are applicable or will also be working here in the Philippines. Then answer solutions or results are seemingly not tested or are factually contradictory. So this is a good avenue for. That's why you have to read literature review, because sometimes one journal will say it's a yes, another journal will say it's a no. So there's contradiction between the two journals. That's when your topic or your title would be introduced. You want to unify both the uh, the affirmative and the negative side of the journals. Okay. Next would be a phenomenon exists which requires explanation, such as yung sinabi ko nga, lived experience of battered wife. That requires an explanation of the experiences and why it's happening. Then there are several possible and plausible explanations for the existence of an undesirable condition. So, for example, is you want to go deeper on the student's depression or student stress. So there are a lot of factors to consider. So there's a lot of explanation to consider. We're just looking for at least one factor that would really connect you to, for example, student depression or student stress or student mental health. Okay.